We are so fortunate to have Dr. Vinayak Agrawal on the show of Health Story Speak. Dr. Vinayak Agrawal is a senior director and head Department of Clinical Cardiology in Fortis Hospital, Gurugram. Welcome, Dr. Agrawal.
Thank you, Manjuji.
Maybe I should request you to begin with the common myths of heart diseases.
Thank you, Manjuji. I'm really happy to be on your show. And I think these platforms are important where we address common myths regarding health, and especially because I'm a cardiologist, so regarding heart. Now, the just to give you a brief idea about where India stands today, we are a very most populated nation in the world, and we are a young nation.
Right.
So if you look at the working population of India, we say the working population of any country is between 15 years to 60 years of age. That is the productive age or working population. We have nearly 736 million people who are young or working class, which is a huge working class.
Right.
And unfortunately, we have seen a deluge of young deaths and young heart disease, sudden cardiac deaths, etc., in the last few years, which has probably been highlighted because of COVID as well, because people were much more aware, they became much more concerned about their health. There were a lot of myths about whether COVID is causing these sudden cardiac deaths, whether the vaccines which were given for COVID prevention were causing these deaths, or is it something else which has been causing these increased number of young sudden cardiac deaths in India. So one of these myths is what I'm going to address today. The second thing to remember is that there are 9 risk factors overall which cause heart disease, right? Which we know of. And I'm sure there are many more which we are still going to find out in future. But they're mainly family history of heart disease. Here, the number one is family history of heart disease, which you have to understand what that means. That basically means that if your mother or sister got a heart disease below 65 years of age, or your father or brother got heart disease or stroke, stenting, bypass, etc. in your family below the age of 55 for men and below the age of 65 for women in your family, first degree relatives, then we label that you have family history of heart disease. Not if your father got it or mother got it at 75 or 80 years of age. That's not considered family history. The second very important and most prevalent cause of heart disease is hypertension, high blood pressure, diabetes, smoking, high cholesterol, lack of exercise or sedentary habits. There is also an increasing evidence about high stress levels, so high psychosocial stress, lack of fruits and vegetables in our diet. There is also a lot of data which is coming up about the overall lifestyle that the people have. So there is actually more and more data which says that Indians tend to have accumulation of many risk factors which lead to heart disease. Like somebody will have hypertension and is a smoker. There is a lot of tobacco chewing which goes on in our country as well, which is equivalent to smoking. So all these risk factors lead to increasing risk of heart disease, stroke or paralysis, peripheral vascular disease, etc. So that is one thing which I wanted to say. Now coming to the COVID era and how it changed the scenarios. Now, there is very little evidence to suggest that COVID or the vaccines have led to increased risk of heart disease or heart attacks or strokes in the population. There were some reports of increased risk of, say, increased heart attack or stroke risk post-vaccine. There were few incidences, but then those instances or incidences will occur with any vaccine. It is not just the COVID vaccine. Most vaccines that we take today will have very small risk of certain side effects, which are known for all vaccines which are being given even to children or adults. So those kind of side effects are not responsible for the kind of deluge of heart disease and strokes that we're seeing today. So that is a myth that COVID is
Right.
causing this.
Okay.
Yeah.
So I think other thing I want to know is about the symptoms. I think, and it's often confused with acidity. Maybe you can tell us a little about how to distinguish between normal acidity and heart disease.
Very, very important question, Manjuji. So, see, a lot of people think that any chest pain around the chest area, is likely to be heart attack. That's not true. Now, let's take the ones which are not heart attacks or not related to heart first. So,
Right.
if you have a pin prick sensation, like if you get a 1 or 2 second pain, like a pin prick, or
Mm.
like a stabbing sharp pain at one localized area. Suppose I get a pain here or here or here or here, which is localized at one point where I can take a finger and pinpoint that this is the area I'm getting a pain. If it increases on breathing, if it
Mhm.
increases on movement, if it is say coming for a few seconds and going away, coming back again for a few seconds, going away, these are almost never heart related
Mm.
pain, right? The heart pain occurs because of the blockage of coronary arteries. There are three coronary arteries which run on the surface. I can show you actually with this heart model. So
Right.
if you can see this model, there are three coronary arteries which are running onto the surface of the heart. One goes
Heart.
at the back, one goes on the right side, and the main artery of the heart, LAD, comes in the front. Now, when these arteries get blocked because of plaques, so if you look at the plaques look like this.
Mhm.
If you look at this is a normal looking artery, this one,
Right.
and these ones plaques, these yellow plaques that you see, if the upper layer of these plaques bursts, it
Right.
leads to uh, the say stimulation of the clotting cascade, and there is a very rapid formation of a clot right at the point where the plaque ruptures.
Right.
This is important to understand because you are not going to get any symptoms till your blockages are 70% or more in diameter.
Right.
So suppose I go for a treadmill test or a stress echo and they are normal today, these stress tests are picking up occlusive disease more than 70%.
Right.
But most of the heart attacks actually occur in arteries which are 50 to 70% blocked.
Right.
And so they will be asymptomatic. You will never pick them up on stress echo or TMT. But if the plaque bursts, that's when you're going to get a heart attack. And that's why a lot of people will say, I just got my test done a month back.
Yeah.
Everything was fine. Why the hell did I get a heart attack?
Yeah. That's a
Because
bit.
your plaque ruptured.
Yeah, because the plaque ruptured. But that's a bit worrisome, doctor, because we think precautionary tests we take, we are we should be fine, and then suddenly the next day, is there anything you can do to avoid it, or it just you have to
Yeah,
accept?
I'm coming to that. So
Okay,
why I explained this to you was to understand what kind of chest pain will you get when you get blockages like that.
right,
So suppose my artery has slowly become from 60, 70, 80%, like, it has gone on. So the moment the blockage crosses 70%, I will start getting significant chest discomfort, usually in the center of the chest, on
right,
walking, going up the stairs. And if I continue to do exertion, the pain may spread to both the arms, jaw, back. That is called a stable angina. It is
right,
predictable angina, where I know that if I exceed a certain threshold, I will get this discomfort along with breathlessness, palpitations, etc. If I stop, it will slowly go away. So heart pain usually occurs over a few minutes. It escalates with chest discomfort, will escalate with exertion. The
right.
moment you stop, it will slowly come down. So it will never be in few seconds. It will always come up in few minutes and always go back in few minutes.
If you
Now, this
rest,
we are
yeah,
talking about if you
yeah,
rest, yes. So this is when we are talking about is a stable patient, stable
right,
angina, where the blockages are stable, there is no plaque rupture. Now, if there is a plaque rupture, there will be a very rapidly forming clot on top of a pre-existing plaque, which may be about 50, 60% blocked. So the patient
right,
has no symptoms prior. This clot now makes the artery 99 to 100% blocked within a few minutes.
Right.
And that pain which you get will again be in the center of the chest, usually radiating to the arm, jaw, but this intensity will be far more. It will make you sweat. It will be like a feeling of doom, and you will feel really, really uncomfortable and sharp pain as if somebody has kind of tied tight rope around your chest. So most of the people will have this sort of a, they'll hold their
Pain.
chest because the pain is so severe. Now that is a sign of a heart attack.
Right.
That's when you should never ignore it and always rush to your doctor, to the nearest hospital with facilities. Do an ECG quickly. Some only 50% of ECGs will pick up a heart attack initially. So
Right.
you have to put a blood test called troponin, high sensitivity troponin. If that is negative, wait. Do not go back home.
Right.
Wait for 2 to 3 hours, repeat your ECG, repeat your troponin, which your doctors will tell you to hold back. So please listen to them, because a lot of heart attacks initially may not be picked up on ECGs or tests, but
Right.
they're developing heart attacks. They're certain, like I always say that before the major earthquake, there are
Yeah.
some
The
pre-shocks and then
future.
there are some aftershocks.
Right.
You have to understand these clues and listen to your doctor. There's so much of mistrust, or say distrust today, that if I go to the emergency, I'm going to get a stenting or angiography unnecessarily. Please don't believe any of that which you see in media. It doesn't work like that.
Right.
Everything is in front of you. The ECG will be given to you. If they do an angiography CD will be given to you. There is everything, all evidence will be given to you. Why would somebody do something which is not required? So
Right.
have trust that the doctor means well to you, and the chances are that you will come out in a much better shape, even if it is a heart attack.
Right. So
Yeah.
I think coming to the earlier point when you mentioned that a lot of young people are getting it, even if we think it's not related to COVID, I think it's increasingly more and more percentage of population is getting this disease. What do we need to do? What kind of protection tests, lifestyle? What do you think we need to do as individuals to feel protected?
Yeah, I think it's, maybe it will sound cliched when I say that it's the most important thing is lifestyle, right? But then
Right.
let's try to break it down. What do we mean by a good lifestyle? Now, see, the problem is that the right question to ask is, how do I prevent plaque rupture? Now, you will see a lot of WhatsApp messages going around, where sometimes some non-medical people, or sometimes even some medical professionals, will tell you that you should do a CT coronary angiogram and find out how much is the blockage.
Hmm.
I don't want to know how much is my blockage. I just want to know whether, if I have any plaques or blockages, will they burst? Am I at risk of developing a heart attack in future? That's what I want to know, right?
Right. Right.
Now, I don't need to know the degree of blockage, because I
Hmm.
can be actually carrying a blockage of 80-90%, which may remain stable for the next 10 years. It may
Right.
never burst. And what prevents the plaque rupture are very simple things. Number one is regular exercise. Simple like 30 minutes walk, which is moderate to high intensity, uh, per day, at least 5 days a week. So it's about 150 minutes of exercise, cardio plus a little bit of strength training, like some weightlifting or
Right.
push-ups, pull-ups, etc., is very important so that you don't lose muscle mass. So about 150 minutes of exercise per week is essential. A diet which is rich in fruits, vegetables, and salads, less fats and less carbohydrates. Carbohydrates are the bigger killer than fats.
Yeah.
So, all your bread, bhujia, biscuits, anything which you can keep in your, say, in your cupboard, which can last for 6 months or so, they all are made in hydrogenated oil. Trans fats may or may not be there, but they're definitely not healthy. Even your normal bread, some people say multigrain bread is better than a
Yeah.
white bread. All that is just semantics. I mean, it is basically bread only. And if
Right.
you've ever seen a bread meat being made, you will understand what I'm saying. The amount of saturated fat and carbs that it carries. Our simple old world things were always better. Freshly prepared roti,
Hmm.
chapati, your simple sabji, dal, etc., which you were having earlier, low-fat dairy products, they are all good. Even meat is fine if you take, say, occasional. So the gravy which you make, so if you're taking a roasted, grilled, or boiled, say, meat, it's fine.
Yeah.
Red meat once in a while is fine.
Yeah.
Eggs, every day you can have one egg a day, including the yellow. That old theory that yellow of the egg should be taken out is not right. So it's not going to add to your cholesterol in your body. So I think eating right, eating less, don't overeat, right? And try and be, careful about what you eat. And the third and the most important is know if you're carrying any, say, silent diseases like blood pressure,
For sure.
sugar, keep them, you check them out. So when the moment you reach the age of 20 years, every 5 years, you should check your blood pressure every year, sugar every year, or every 5 years, check your lipid profile. 10% of the population carries what we call as a familial heterozygous familial hypercholesterolemia, where they have genetically very high cholesterol levels, especially the LDL levels.
Right.
And it's silent. You will never know till you actually get it checked. So if I pick them up early, I can treat them early.
Right.
So getting yourself checked every few years is a very good idea. Okay, doing these basic tests. You don't really need to go for a treadmill test or stress echo every year. I mean, you could. It's sometimes part of your executive health checks. But more important than them is your lifestyle, your, say, risk factors like blood pressure, sugar, high cholesterols. You have to be active every day. Your Saturday, Sunday should not be about relaxing at home and watching a lot of television and screens and other things. I think
Right.
that should be minimized. You should be more active outdoors, sit in the sun, enjoy the nature, take frequent breaks. Recreation is very important. Being happy,
Yeah.
make friends, spend time with friends and family. All those things matter because eventually, please understand, 90% of diseases are inflammatory in nature.
Mm.
Inflammation leads to heart attacks. Inflammation leads to 90% of the diseases. And the best way to decrease inflammation is to eat right, exercise, and staying happy.
Excellent. Thank you so much. I think these are really, really wise words, wise advice to follow. One, personally, I haven't been eating the yellow of the yolk of the egg, thinking that there's a lot of cholesterol there. So I think for tomorrow, I'll change that. Yeah.
Yeah.
Really grateful for you to come and talk on Health Stories Speak. I'm sure my viewers will be very, very happy to listen to this cast. Thank you so
Thank you,
much.
Vanshit. It's been a pleasure talking to you. Thank you.
Thank you. I'm so grateful to all the speakers on Health Stories Speak, and especially to the doctors who selflessly share their advice on the channel. Let's build this health community further and help each other to stay healthy. Please press the red button and subscribe to my channel, Health Stories Speak. Thank you very much.